Dr. Bill Adams here. This is a special edition of No Spin Live. And with me, it's really an honor to be with three really incredible international plastic surgeons. But these plastic surgeons are some of the clearest thinkers in our specialty. And we're here not really to talk about plastic surgery, but we're talking about something probably more globally important. And obviously, it's the topic that you can't get away from right now, but the coronavirus, or CVD-19. This No Spin is going to be on data. There is a lot of scientists that believe we don't have very good data, and we're kind of acting on what people see on social media, and it's like a knee-jerk response. With me, we have Dr. Charles Randquist from Stockholm, Sweden. Charles, how are you?
Thank you for having me.
Absolutely. Dr. Tom Wiener, just my neighbor a little south here in Houston. Tom, everything going as well as possible in Houston, I'm sure?
Bill, Houston does not have a problem.
And then Dr. Dave Sieber, who's presently locked down in San Francisco, California.
We are sheltered in place.
And we just did a webinar last night, and Dave did a spectacular job. So listen, Charles, I want to start with you. You know, we've been corresponding on a WhatsApp group, and you've had some very compelling and intriguing kind of data you've shared with us. But things in Sweden are not necessarily like they are in a lot of other places in the world. I'd like you to start out with that and tell us a little bit of your thoughts.
Well, back in Sweden, it's really business as usual, in the sense that we're not put in lockdown or quarantine. We're able to socialize without being marked as bad people. So it is different. I mean, one of the things, for instance, is we're one of the few countries, if not the only one, basically in Europe that hasn't shut down schools. Now, high school and universities now, yes, they are asked to have education online, but primary school, no. And kindergarten, the same. And one of the reasons for that is the government did a test in Sweden where they shut down the kindergartens and the school, and basically 50% of all the staff in hospitals didn't show up. So the consequences for the society and the healthcare was dramatic. So based on those concepts, the government in Sweden has decided to step by step take measurements depending on what happens in the country, also looking at other countries. Now, other countries that has had this basically very similar policies, Great Britain and Germany, are locking slowly down. But if we would compare the numbers, for instance, on death in Spain and Germany, and they've had approximately the same number of coronavirus affected people. Now, we all know that the ones who are, the numbers are probably much, much higher, probably 10, 20 times the numbers that are actually tested. But if we look at the numbers who've been confirmed coronavirus affected and the death rate in Spain is more than 20 times the one that in Germany. And they have the same numbers with detected coronavirus. Now, why that is, we do not know, but there is definitely a difference from country to country. Now, this is Europe. Now, Italy has more death cases than China, confirmed from China, and half the numbers of affected. So Sweden as a nation, compared to Norway, which has lockdown, and Denmark that has lockdown, and basically Finland also, has taken a different approach. Now, there are many different reasons for that, obviously, but one of them is business as usual means that stores are open, schools are open, and the daily life is going on. Now, we all know that the economical effect of the lockdown is quite dramatic. And also the healthcare as such is affected because staff won't show up. So I feel very confident, and I'm very positive about the way our government so far has handled this. I don't know if it's right or wrong, but what I do know is that most of what's being done today is not based on science.
Yeah, it's crazy. And too, you talked about the number of people with the virus being 10, 20 times higher, and it could be even higher than that. And that's one of the problems, that nobody knows what the denominator is, because we haven't even done an antibody study that tells you if people have been exposed to this. So, Tom, I mean, you have been somebody that's been generating data and looking at data for many years. What's your initial thoughts on this?
Well, I think to really understand the coronavirus, we have to put it into perspective of something that we can grasp, which is the seasonal flu. The seasonal flu, the numbers there are truly staggering. The reason that we just don't hear about them too much, in the media every year, is because it is every year. So we can't shut down the government. We can't stop life every year for 6 months. The numbers are really important. That absolutely we don't know the true incidence of coronavirus in the United States or worldwide right now, nor do we know the true numbers of influenza, because everyone is not tested. Less testing currently for coronavirus because the manufacturing for the tests is just ramping up to full production. Just to go over a couple of just brief numbers, if we compare this to the 2009 swine flu, the H1N1, which came out of Mexico, there were 762 million cases worldwide. There were 285,000 deaths. 285,000. That's a 0.02% mortality worldwide, but because that the mortality rate is very low, because the incidence was extremely high. The seasonal flu in the U.S. Currently, on average, this is from the CDC, this year, 10 of 2019 to 3 of 2020, 36 to 51 million cases, 370 to 670,000 hospitalizations, and 22 to 55,000 deaths. Just in the U.S., worldwide deaths on average from the CDC can approach 640,000.
And I think right to date, there's been about almost, 11,000 deaths from coronavirus worldwide, globally.
Correct. Yeah. It's 10,545 deaths in the United States, 219 deaths, 90,000 have recovered worldwide.
Dave, what are your initial thoughts on this?
Well, I agree that the main problem is we don't have any data. There's no data, zero. And because of this, I think the prevalence of social media, of a lot of the news outlets, have turned this into something that's very severe. And they've made it, it's a pandemic now. And we're seeing basically the whole global economy affected by this. But again, like Tom said, it's based off of nothing. I mean, there's really no data to look at this. And just like Charles said, I really do believe that the actual number of cases is probably, 10 to 20 times what we think it is. And there's even a good chance that this could have already come through the United States in December. I mean, we don't even know that this is the first time it's come to the US, because the first reported case of COVID in China was, I think, in early November, was when they were first looking into it. So it's been around for a long time. And for us to think that it's just now gotten here in January, February, I don't think is correct. I think it's probably already been here, which also just increases that total number. But because we don't know these numbers, the mortality rate is going to be much lower than what we're commonly seeing from a lot of these news outlets.
And Bill, can I follow up on that? There is one population that we have 100% testing. That's the Diamond Princess cruise line. Okay, the ship. These numbers are from the analysis of that ship. There were 3,711 on board. All were tested. 634 of those tested positive. That's 17%. Of those, 328 were asymptomatic. Of those with symptoms, the mortality rate was 1.9%. Of all who tested positive, the mortality rate was 0.91%. of those 70 and older, the mortality is 7.3%. So the data was extrapolated to the Chinese numbers, and the mortality of COVID-19 will probably end up being somewhere between 0.5 and 0.8%. Seasonal flu is about 0.3 to 0.5%. So it's going to be probably a little bit higher, but this is not the end of the world as we know it.
And Tom, just to follow up with that, you're talking about the flu, it's publicized so heavily. The media is pouring this out. You've got social media that's covering this, literally by the second. And nobody, we're all empathetic, I think, to the fact that yes, people are dying of this. There's even some younger people. There can be a 20 or 30 or 40-year-old, but you've got to look at the data. The vast majority, even in Italy, where they've had a huge problem with this, the vast majority of people that get sick have multiple comorbidities, and the people that get really sick have the most comorbidities. And even younger patients can have comorbidities if they vaped, if they smoked. There's many things that just aren't brought into the equation, especially when you talk about the Diamond Princess ship data, which is probably what a lot of the viral experts think, is that there is a huge population of this that has asymptomatic infection, probably develops a passive immunity to this without ever becoming ill.
Correct. Yeah, I think that's the case. And it's interesting that now in the media the past couple of days, there's been the talk of that the younger population is now showing up with more of the disease. If you look at the actual age group that they're talking about, and also stating that men are more likely to die than women from coronavirus, but you also, like you mentioned, vaping and smoking. In that younger age group, that's the highest incidence of vaping, upwards of 20%. In China, where the mortality rate for men is significantly higher than women, the smoking incidence of men versus women is completely at different ends of a spectrum. Men smoke far more than women in China, and that's why one of the possible reasons the death rate is higher for men.
What I commonly see is a lot of these places cite that there's younger people, 20 to 45 or something, who are hospitalized. But what they don't explain is that really the deaths are still in that older population, 65 plus. That even though there maybe 20% of the people hospitalized are younger, they're getting better. So a lot of the news, the way that they take these facts and spin them, it kind of doesn't paint the actual story.
So we've taken a different direction in Sweden. Now, we have to understand, of course, our environment is very different than, for instance, North Italy, which has been very affected. We have a different population group. We have a different environment where families live different. Our elder people live in nursing homes, so we're able to isolate them. And that's something that has been conducted by the government, where we've been saying the ones who should be put in quarantine and protected are the elder ones. But otherwise, the rest of the society is not. Now, I've spoken to colleagues in Italy, in North Italy, where, they've surpassed China now in death. There are more than 4,000 victims in North Italy. Now, in that part of the world, they live children, grown-ups, and elder people together. And of course, in that environment, when you quarantine patients and people in that way, of course, the disease will just rapidly spread. And if there's one thing we learned from the Spanish flu, was actually when there wasn't any room, and this is 100 years ago, when there wasn't any room to treat patients indoors, they were put outside and in tents. And those patients actually survived in a higher rate, and the staff taking care of them survived in a higher rate. So confining people to closed areas where they're basically touching the same thing and breathing the same air, etc., and there's no fresh air, obviously already 100 years ago what was told to us, that's not the way to do it. And that's precisely what's being done. So yes, the Swedish way is very different compared to the rest of the world in general. And so far, so good. But like I said, I don't know if it's right or wrong, but what I do know is that the machine, the financial, the economy is working. People are not committing suicide because they're confined, not being able to walk outside. We're living in a democracy. And if the government would tell us we cannot walk out, well, suddenly the democracy as such might be jeopardized. And we do know that there are already beginning to create situations in Spain and in Italy. So a democracy where the citizens take a responsibility. So there are so many things being done today that I find are quite hysterical. And like I said, tell my friends, they have to keep a cool mind, a warm heart, and clean hands. And we need to think in a different way and not get hyped by what social media or dramatic, sensational news are telling us. Fresh air can never be bad, especially now when it comes to virus.
Yeah, I thought social media was just a gong show for my kids, but it's actually adults that are just following social media like it's the Surgeon General. Tom, could you comment on? I think one of the things that I talk to colleagues even, and we have discussions about this because, again, I don't think we're not empathetic. It's not that any of us are not empathetic to a lot of what's going on. For example, in northern Italy, they've outrun their critical health care system, and that is occurring. And that's a big problem. But could you comment on that? Is this the type thing that is all coronavirus? Like, are the ICU beds and ventilators all just sitting there dormant until all of a sudden, like, a bunch of coronavirus patients came in there and overran the system?
Well, the data from or the incidence in most hospitals of bed usage, ICU usage, is really quite high. And this is the important point that we have to make. If you look at the difference between the seasonal flu season and the non-flu season, the bed usage, the ICU usage goes drastically up. So we put the coronavirus on top of the seasonal flu season. What do you expect? I mean, this is a situation where we know that the coronavirus is not absolutely identical to the average H1N1 seasonal flu. There are some similarities. There are a few differences. There are more or lower pulmonary issues. There are more cardiac issues. So some of these patients will, at least in theory, get sicker. But as far as the overall mortality rate, the overall illness rate, we don't have those numbers. But once again, that Princess Cruise Line ship, the Diamond Princess, that data is compelling. And as the numbers increase, as testing increases, that will really show the true numbers. But as far as overwhelming the capacity of hospitals, ICUs, it may, but it's because it's sitting on top of the seasonal flu.
Tom, I just like to reiterate what you said because I think it's extremely important. It's important for people to understand that, number one, there are 30 and 40-year-old people that die of the seasonal flu, and that's been happening year after year. But you never hear about it because it's not news. It's not on social media because nobody's following it. So that's nothing new. The second thing is that our healthcare system globally, this is true in the United States, and I think it's true pretty much everywhere, is on the limit. So, for example, in the intensive care units, when I was doing a lot of microsurgery, you'd have to get an ICU bed, pre-reserved for your patient. We'd have to cancel those cases routinely. Why? Because the ICU is full. The ventilators are all being used. And this is well before coronavirus was ever known about. So, again, the ICUs are not sitting there empty and all of a sudden we filled them up and overrun them with coronavirus. The problem is that this is a new entity. But even Charles, you sent that pulmonologist detailing this, and he said basically there's 108 viruses that cause flus and problems, and we have tests for 7 of them, but the 108 of them probably cause problems. So who knows what's causing the problem? But it doesn't take much more volume to start causing a problem.
The sad thing, what this pandemic is showing us is that our healthcare system is so stretched due to financial reasons and other political reasons. And I do understand the fear among governments suddenly understanding that they are not fit to take care of these high numbers that in a very short period affects the population and suddenly shows high numbers of death within a short period. So I do understand emotional fear. The problem though is due to this, we are today creating a situation where elective surgery is not being done. We are actually putting patients who are risk patients into worse situation because they're not able to get the treatment because we are so scared of what might happen if we peak with the coronavirus. So I do understand the fear that goes through the governments. Nevertheless, there are a lot of things being done that are more experimental, where they are quoting things that are not based on numbers. It's more rumors. And everyone doesn't try, or I'll rephrase myself, everyone is doing what the flock is doing, because if they try to be different than the flock, they're doing something wrong. And this is what I find more scary, because to Tom's point, this is sort of a flu. Now, if we really get into a bad situation where there's actually a virus that is a high killer, what are we going to do then? So I do believe it's important to collect numbers. We do know that this is a more respiratory coronavirus in general. It affects more the respiratory system. It affects elder more. But to shut down the society as such, the financial consequences might actually over time be more damaging. So hopefully we'll learn something from this. And good, luckily, different governments are doing it different. And probably in a year, we'll be able to measure actual numbers.
And even just daily resources, but especially medical, a way for coronavirus treatment in a situation where we don't know the true numbers, and you deny those resources or limit those resources to patients who have other illnesses, such as heart disease, such as cancer, there will be a death rate for those patients due to the resources that we take away, and that's a problem.
I've got a family member that needs to have a pacemaker, and they've canceled it for this Monday because of for need for other critical care, which the chance, again, based on the data, the chance of that person having a problem, fatal or catastrophic heart problem is far, far greater than somebody having an issue with coronavirus.
Right.
And this is exactly what you're talking about. Back the numbers and data, Dave, I just want you to briefly detail for people, like, for example, you've got to look at the numbers, and it's got to be a scientific analysis. You and I just heard the other day, just yesterday, there's a study where they've looked at two different strategies in Italy, Lodi, Italy, which is a town in Italy, northern Italy, and Bergamo, which is a town in northern Italy. And they, Lodi, I think, did very strict social distancing. Bergamo didn't, and they showed this graph that shows how Lodi minimized the number of cases, and Bergamo had a very quick uptake of cases. But explain to people what the issue is.
Well, so when I saw the graph, the first question that came to my mind is, well, what's the total population of these cities? And it turns out that when that Lodi had a population of, I think, 40,000, and I think Bergamo had a population of like 125,000. So when you correct for these populations and the total number of cases, the number of cases per thousand actually ends up being exactly the same. So one of the things when we see a lot of this data is we can't compare countries like Italy to China or Italy to the United States in case numbers, because we're a much larger population. So a lot of these graphs are that you see online, that you see from CNN or Washington Post, wherever you get your news, you need to be very careful about what the information is actually in there, because a lot of it's very deceptive, and it kind of paints the picture that the author is trying to show you, but might not be the actual facts.
No doubt. If we did through the history of mankind, if we did what we are doing now, we would already be extinct, because we would be making decisions that we never would have carried on. I mean, I think the only data, Tom, you stated the data, the Diamond Princess data really is the only real data that we have, because that's the only place where a single population in the same place has been tested. And it may not be the end-all be-all, and maybe that doesn't exactly pertain to every geographic region, but it is the best data. But you don't hear anybody talk about it, because
right.
It's not along the party line exactly as Charles is talking about.
Correct.
Now, Tom, I want to just switch gears a little bit. I know you've done a lot of research into, where did this virus come from?
This is the interesting thing. The various pandemic outbreaks, we've had a number. The swine flu was from Mexico. It was from a pig population. MERS was Middle Eastern. That was actually from a camel population. This virus did come from the area of Wuhan in China. And interestingly, some of the genomic testing that has been done on the coronavirus indicates that it is a bat coronavirus. However, more importantly, it seems to be a recombinant virus, but not necessarily that it can be a recombinant virus can be a naturally recombinant virus. So there are some codons, in other words, the three nucleic acid codes in the RNA that seem to indicate or seem to lean toward also a snake codon. So this is a virus that probably has passed through at least two different hosts before it got into the human population. The data is interesting in the sense that, of course, we know that in Wuhan, and this was probably in early November, in late December, and I want to get his name right, God rest his soul, Dr. Li Wenliang and 7 other doctors warned the other residents and physicians at the hospital in Wuhan that there was this virus and that this was acting very similar to SARS. Okay, and that's really the key. The Chinese government reprimanded them, and the police actually came after them. They were released, however, of course, they were watched closely, and unfortunately, Dr. Wenliang died of the coronavirus in February 7th, and his colleague, Dr. Zhang Ming, also died of the coronavirus and shortly thereafter, and both were young and healthy. My personal bias is this is an unusual coincidence. As has been mentioned in the media, but not necessarily focused on. First of all, I'll preface my statement by saying we're doctors, we're plastic surgeons, we're also scientists. And as scientists, we are obligated to look at every possibility. If you don't, then we're not scientists. There have been some, they call them conspiracy theories, but if you really analyze this and decide what is a conspiracy theory and what is not, it's a very important key. There are 2 virology labs in Wuhan. One of them is government owned, and of course, the other one is the so-called private. But of course, we know in China, communist government, everything is owned by the government. So both are government owned. The lab in Wuhan, there's a question as to whether this virus actually came out of the Wuhan, what was called the wet market, the animal market, where people go in and buy animals for food, unusual animals such as bats, such as snakes, and things like that. The conspiracy theories are that that this was a lab-grown virus out of the Wuhan virology lab, or the military subsection of that lab. I'm not sure that that's necessarily an important defining factor, whether this was some sort of a military bioweapons research, or whether this was just a mess up and an animal escaped, or an animal was sold in the market, or any of the other conspiracy theories. The scientists and the media that are downplaying these so-called conspiracy theories are downplaying what they are called lab developed, in other words, bioengineered. That's very, very different than a lab having a virus that they found in the wild and studying it. Now, whether they're studying it for scientific purposes or studying it for military purposes is not necessarily relevant to this section of the discussion. It's obviously important more globally or politically, but the fact that something that's being studied could escape from a lab clearly happens. Whether that was an accidental escape, whether it is a lab worker who had sold a lab animal on the market, very similar as you all remember, very famously, not too far from here in Carville, Louisiana. That was the location of the famous leprosy colony and laboratory hospital for many years. And the research that was done on the organism for leprosy was done on the 9-banded armadillo because it was the only animal they could find that was susceptible. Now, interestingly enough, the 9-banded armadillo is now an endemic host to leprosy. And what they don't believe that an animal escaped, but they believe it was transmitted from a leprosy patient to a 9-banded armadillo, and then it expanded beyond that. So we have to look at the real conspiracy theory is the suppression by the Chinese government, the confusion caused by the Chinese government, and the delay caused by the Chinese government, resulting in many deaths. This could have been at least minimized, maybe not prevented, but at least minimized. But more importantly, going forward, we have to be able to develop a system that is more open to what is going on in China to minimize or prevent this from happening again and save lives that way. So if you want to use that as a conspiracy theory, that's okay. I'm okay with that.
All right. Well, listen, I think I'd like to get some concluding remarks from each of you. It's been a great discussion. I think we're going to probably want to have some more of these in the future, but Charles, why don't you lead off? What's your concluding remarks?
I'm not an epidemiologist and I'm not a statistician, but I try to think of it logical. And one of the reasons why I think the approach we're having here in Sweden is, in our society, quite a smart one, is a virus needs a host in order to go to another human being. And by isolating elder people, but letting the children, which are less affected, carry the disease and be immune, I think is quite logical. Youngsters, children. Why? Because they are the ones who meet more people in a day than elder people. So by having a large population which are younger, that are immune, you actually lessen the risk for the virus to spread. Why? Because it needs hosts to spread. So once again, thinking logical in a situation like this, actually, and thinking outside the box, actually saves more people than maybe what's being done today. And on top of that, of course, the financial consequences, which we can't oversee, might be over time more damaging and causing more death in different ways than it's being done today. So, like I said, a cool mind, a warm heart, and clean hands, and looking at this in outside the box, non-hysterical way is the way to approach this. I do understand that people are scared, but once again, we as doctors, we're supposed to be leaders in these situations when it comes to diseases. And it's not always the one who screams the loudest who are the most efficient one long term.
So I do want to bring up Anthony Fauci, who I think is he's the guy at the NIH who's kind of the lead virologist for the US. And I need to give him kudos because I don't know if you have watched any of his videos where he gives updates on stuff, but he actually, for a doctor, is very factually based. And I watched an interview with him that was on, I think the editor of JAMA was interviewing him. And it was an excellent interview just because of the content, but the editor would ask Fauci questions, and he would very clearly say, we don't know, we don't have enough evidence to, support this or refute this. And I feel like we're still in that very early stage where we don't have enough evidence to support or refute. We honestly still don't really have any idea what's going on. And I think that a lot of the stats that Tom brought up are very pertinent. I think that there's way more people out there that have this than we think. And I think the mortality rate's a lot lower. And the prevalence of social media and the news has really taken something that might have otherwise been treated more like the flu and has turned it into kind of a hysteria, which might have long-lasting economic effects on us. And I think Sweden probably is doing something that makes more sense in isolating the elderly who are really, prone to dying from this, and letting the rest of the people get antibodies to it. Because we talked about the Spanish flu a little bit during this, but that's basically what happened during the Spanish flu too. I mean, they didn't have ventilators to put people on. People eventually had to leave their houses again and get exposed to the virus and become immune to it. And I don't know how long, at least the US government is going to keep sequestering us, but I think there is going to be a time in the hopefully near future where we get to go back about our normal lives again and can start to develop a pool of antibodies to the virus.
And Tom, your concluding remarks.
I completely agree with David and Charles. I think the Swedish model is a very rational model. I think herd immunity is an important issue. Just like Charles said, isolate those that are most susceptible, that the danger is the highest, the elderly, those with comorbidities. Now, I'll take another tack that I think that, once all of this disaster, especially the economic disaster, settles down, I think there will be some good out of this huge scare. I think we're going to end up being able to develop faster testing for viruses. I think we're going to be able to, there's going to be a major push for the development of vaccines faster, and for the FDA to allow vaccines to get onto the market quicker without huge legal repercussions to the manufacturers. We're going to develop additional antiviral medications. We didn't touch too much on that, but there's some very good data that one of the Ebola antiviral medications has shown some significant promise. I think as far as a political issue, that one way or another, China's repression of their own people, their poor governmental lab policy, the fact that their people either have to or want to eat bushmeat has got to slow down. I mean, you can't eat bats and not expect to get some weird disease. If this was a bioweapon, then then this needs to be stopped, and we need to condemn the Chinese government for the secrecy that let this get out of control. Another virus will pop up in the future. We have to be able to jump on it quickly and be transparent between governments so that ultimately the population, the people, can be saved.
All right, well, listen, that's great stuff. And, I think maybe this has been some of the most scientific and kind of innovative thinking that I certainly have heard in a long time. So I really thank the three of you for that. It's kind of like they said in that movie, Jerry Maguire, show me the money. What we're saying is show us the data, because that is going to lead the way for us to move on from the whole coronavirus illness and debacle. So if you want to see more of this, you can see it on the plasticsurgeonchannel.com.